everyone, I'm Dr. Ozzy. I'm a board certified dermatologist, and as a skin doctor, I'm very passionate about teaching you all about the skin. I know that many people may not have access to a dermatologist, so I'm here to bring you valuable skin tips. So don't forget to review, subscribe, and comment below what you want to hear from me next. Today, I want to talk about skin tightening because I have so many patients that come into my office that always ask me, what can I do to tighten my skin? And they go like this with their fingers and they pull their jowls up and they want to know what removes this and makes the skin tighter. Here's the honest answer. There are no creams, no serums, no potions and lotions that are gonna lift and tighten your skin. There are ingredients that science has proven helps stimulate collagen and elastin and preserves your collagen, keep your skin more youthful if you start on these ingredients and are consistent with your skincare regimen. One of these ingredients is retinols, and science has proven over and over again that retinoic acid, prescription retin-A, tretinoin, retinol, these are all classified under retinoids. They do help stimulate collagen and preserve your collagen. And they help with fine lines and texture over time. So that is an ingredient to look for if you're looking for creams that help with your skin. Ingredient number 2 is vitamin C. So vitamin C is an antioxidant and it helps with preserving your collagen, but also keeps your skin from getting damaged by environmental stressors like sun damage, pollution. So it's also a great ingredient to help preserve your skin. Number 3, growth factors. They help by supporting your dermis and delivering these nutrients that are important in keeping the skin quality firm, but again, not gonna tighten your skin. Now, what is gonna help tighten your skin? So when I have people come into my office and they're doing this, and this is the result they want, then you're looking for maybe a facelift because our skin is connected by a thin muscle. And what a facelift is taking that muscle and pulling it tight, because with age, it gets stretched out. That's why you get the jowls and you get the sagging. So what a facelift does is it takes that and pulls it tight, lifts it, repositions it. Now, what if you don't want to do surgery? Because nowadays, nobody wants to have surgery. People are looking for non-invasive ways to help lift the jowls and tighten the skin. Radio frequency, that is a hot trend right now. They heat the collagen and firm the skin. They tighten the skin by heating the collagen and causing it to contract. So what I want to do is I want to call up my very esteemed colleagues, Dr. Abram, who is the head of laser and cosmetics at Harvard Medical School. Guys, this is where lasers were invented, where cool sculpting was invented, where the theory of lasers, laser hair removal, all these technologies all come out of Harvard. So I called him up and this is what he had to say.
So appreciative you're able to jump on this call with me.
It's great to be here, and I dressed up for you because I want to raise my game for this. So I'm very excited to be here.
They elevated it compared to the last Zoom call that I didn't know how to record. I wanted to come to the expert, Dr. Abram. So tell me, what are your thoughts on skin tightening? Are there particular devices that actually work?
Skin tightening, just to get the overall view, these aren't procedures that are like facelifts. What they are is they are a way to get a small but noticeable improvement in tightening of the skin. On the one end, you have doing nothing. On the other end, you have surgery. These devices take you about 20 to 30% of the way towards a facelift. And what's amazing about them is that they're non-invasive. They tend to be very safe and they don't have downtime. The basic idea behind all of them is depositing heat into the skin, causing a contraction of collagen, and causing a wound healing response that brings collagen to the area and also tightening elastic tissue. So these are ways to turn the clock back, make you look more refreshed. We're seeing people getting these procedures to prevent early jowling, early signs of laxity.
I agree with you on that. They don't replace surgery. Is there a particular type of treatment that you've seen great results with that you favor?
One thing that's really important to understand is there's some unpredictable nature to this. Some people do better than others, and you can have 3 people and they'll get 3 different results, and you won't always be able to predict who will do best with each. I think the ultrasound devices, Ulthera, which is micro-focused ultrasound, Softwave, which is an ultrasound, Thermage, which is monopolar radio frequency, and then some of the needle radio frequency, like the Fractura, the Profound. I think all of them provide some degree of tightening. Typically, if you explain to patients the amount of improvement that they're going to get, they tend to be happy with these procedures. And for the most part, people who come in for these procedures have already decided they don't want surgery. They just want to look a little bit more refreshed, a little bit better. And for the most part, these devices deliver on that.
Yeah, I agree. I think they're great non-surgical options for the right patient.
It's really nice to be here, Dr. Shirazi. Thank you.
Then I decided I'm going to call up my colleague, plastic surgeon, Dr. Sheila Nazarian, who has her own show. I wanted to know what she had to say about skin tightening. So check this out.
How are you?
I'm doing good. It's been a little crazy here in LA, but keeping busy as usual.
So this week, I'm talking all about skin tightening. And everyone always asks me, what can I do to tighten the skin? The people that come in and they do this to their face and they're like, I just want to tighten my skin. So what do you tell your patients? What are you doing for that these days?
Well, I mean, luckily in our office, we run the gamut, right? We have injectables, we have devices, we have at-home devices on the skin spot.
Yeah, so tell me about that, the at-home devices.
Yeah, I mean, I always felt like so hesitant to recommend at-home stuff because I didn't know if it worked, and also, like, how is it going to compare to the in-office stuff? And during quarantine, we really didn't have a choice, right? Everything was closed down, so it kind of forced me to like whip it all out and try it on my face and just see what works. So I'm loving the derma rollers, using those with, like, I love the Tensage, that snail growth factor. Love that. Cyan makes a radio frequency device that actually does tighten skin and plump. I'm using it on my neck, my stomach, my thighs. I always tell people, the more you can do at home, the longer your in-office stuff is going to last and the faster you're going to get results. So it's like going to the dentist, getting a cleaning, you still have to brush your teeth at home. So if there's like good stuff you can use at home, do it. Fantastic. Yes. The better you look, the better I look.
So I want to try the device that you're talking about. Where can I find it? Where do I get it?
Yeah, it's on theskinspot.com. That's actually my curated site where I only put the best of the best. So we all have, we all agree that medical grade is the way to go, but not every product from every brand is a must have, right? I only post the hero products that people are like obsessed with, because honestly, in the last 5 years, I think the technology's gotten so good. And not skin tightening is the holy grail. We all know that. And actually we have devices and technology that are worth it now, which is awesome.
I know. And it's like a lot of these technologies have no downtime. So you could do it literally and go and pick up your kids or whatever you need to do. So
exactly.
I love it.
I'll the one tip I would put in there too, is just let them know that if they, there's like NuFace, there's the technology that will tighten muscle at home too. But if they are using the radio frequency devices, if you're using it right on top of where you've had filler, the filler will melt. Or if you use it right directly on top of where you've had threads, the threads will melt.
That's a good point.
Yeah, on the one side, if you have crappy filler and you want to melt it, use radio frequency. And on the other hand, like, if you do have like tear trough filler, for example, don't go using the radio frequency right directly over it because it will melt it.
Yeah, that's a great point. I'm so glad you brought that up.
Okay, awesome. Good talking to you.